I'm David Mason, the Director of Public Health for the town of Sandwich, and today we're doing public service announcement number 19. We have brought with us today Randy Hunt, State Representative for the 5th Barnstable District. Is that correct?
That's correct.
Okay, just want to make sure I have my government correct. And we have Chief Burke here also with our coronavirus update.
Morning, Dave. Thank you. The numbers as of May 27th, we have 75 recovered, 14 active cases, 3 deaths, no hospitalizations. There was an uptick in numbers this past week, and again, a lot of that's attributed to testing. The majority of the cases that we saw are still healthcare driven, so it's following the pattern that we've had the last couple weeks.
I'll add in. We'll add in. We're seeing a grouping in what age group? Let's talk about that.
Yeah, so let's see, high school aged and college age. And, you know, the younger population, there is some groupings going on with that. And again, we understand people want to get out, and that's completely understandable. We just got to try to maintain that social distancing if we can to keep the numbers level or decrease.
Because we also have seen the trend with, even though college went remote and colleges were closed, there were a number of college students that stayed up because they were in apartments, and we do have cases that are coming back from college and being positive. So as far as you enter summer activities and with your friends, just be cognizant that, you know, the interaction should follow protocol just because of the potential of what occurred back at school and what they're bringing back here. So with that, we have Randy Hunt, and we just wanted to talk to Representative Hunt to discuss where the state's at and Randy's knowledge of what we may see coming and what we're dealing with. We've entered that phase of the opening phase that the Governor Baker has put forward. We've had conversations with Randy in the past weeks as far as his thoughts and our thoughts as far as how we can move things along. So I'll turn it over to Randy, and we'll go from there.
Thank you, Dave. I've been advised not to sing for the safety of everybody in the room, which oddly enough is something I've been told for many years. First slide, second slide. This is something I saw a couple of weeks ago that is an interesting comment on the new normal, and I'll give you a second to see that. But we're already trying to get used to wearing masks, doing all the things that we probably should have done for years, like wash our hands thoroughly. And in the State House, it's no different. We haven't met in a session with everybody at the State House now since this whole thing started, although we have had a couple of conference calls tied to watching the happenings on the floor via video, and that's been working okay, although it's certainly not as nice as being right in front of your colleagues and handling things face to face. On the next slide, I just wanted to give you my take on what's been a few short months, but I titled it perhaps longest months ever. Seems like every day is a long day, and every week brings with it new news about what's going on, new statistics, new information about COVID-19 and some of the effects of it that we didn't know about before, the promise of vaccine development, all these things. And in this chart, I simply, to put into perspective where we are, which is towards the end of May here, in January, the United States, in the entire month, confirmed 6 cases of COVID-19. In the next month, we had the travel advisory issued for China and South Korea, yet COVID-19 popped into the New York tri-state area coming from Italy. And they were having problems over in Europe, as we know. In March, the Summer Olympics were postponed, and we were up to 1,000 reported deaths, and we had severe shortage of PPE all over the country at that time, as well as a severe shortage of the ability to test people, and that went everything from people, supplies, testing ability, machines, all that kind of stuff. In April, the famous President Trump suggesting testing household cleaners and UV lights to treat COVID-19. That's a cringeable moment for sure. At the same time, we passed 50,000 deaths in the United States. And a lot of people would think that some of that, particularly early in this thing, we may have had a number of deaths go by without recognizing what the cause was. So I'm as convinced as anybody that our number is probably undercounted. And in May, we're already focusing to reopening, which I support if we do it safely. And then, unfortunately, the guidelines that were put out by Trump's own coronavirus task force were ignored by a bunch of states, not here, and by himself. It took less than 24 hours for him to disavow those metrics that you need to meet in order to reopen. And then, of course, today, probably in the reporting, or tomorrow, we're going to be above 100,000 deaths. Now, what's been happening on Beacon Hill? In March, the first thing that we did was put in additional money, $15 million worth, to the DPH, the Department of Public Health, county and local health agencies, in order to do the things that they're having to do that go well above and beyond what is a normal effort by all of these folks. And since then, we've added some more funding. We gave towns flexibility to be able to postpone town meetings. There's more of that in the works now, relative to possibly being able to attend town meeting virtually. So that's something that's not passed, but it's being thought of. The towns can actually pass a month-by-month budget for fiscal year 21, if they so choose, without having a town meeting, a maximum of 1/12 of the prior year budget. But I would caution everybody that 1/12 of the prior year budget may be a little too rich for the amount of taxes and all that are coming in right now because of this situation. So I'd be careful about that. In April, we relaxed some requirements for schools relative to MCAS testing, the brand new 3-year plans that were part of the overhaul of essentially a Chapter 70 overhaul that we went through, and for budgeting, liability protections for doctors, nurses, EMTs, all healthcare professionals, given the number of people that we are bringing back from retirement to help, as well as all the first liners who have been here, and a lot of people coming from out of state and hurrying up their credentialing so they could serve sooner than later. It needed to come with a bit of respite on lawsuit liabilities, and we passed that as well. And then in May, this month, we authorized what are called RANs, Revenue Anticipation Notes, because we pushed tax day back from April 15th to July 15th. That's one thing for the federal government, but which has a year end of September 30. But for the state, it runs us into the next fiscal year, which creates lots of heartburn. So we allow the treasurer to borrow some money on revenue anticipation notes, and those allow us to calculate what we think we're going to be getting in July, and use that money to pay off the RANs over a period of time. And we also have a couple of bills that are pending relative to more frequent and more detailed reporting in long-term care and elder housing, so that we have a better handle of what's going on there. What we know is about 60% of the deaths from COVID-19 have been with people living in these types of places, and we have plenty of those on Cape Cod. Keep in mind, Barnstable County is the third oldest by age demographic in the country. So we have kind of the perfect scenario, unfortunately, for the coronavirus to spread throughout our population. And then we also have some things that we're doing relative to town meeting, and we have guidance that came out on graduations. And the folks here have done a pretty good job of sorting out how that's going to happen. I hate the fact that somebody is a senior in high school with all of those things that you normally do as part of that, for those to go by the wayside. Many of those are going to go by the wayside, but if we can salvage some of the most important things like walking across the stage to get your diploma, I think that's an awesome thing to do. And then lastly, this is in my humble opinion, piece. Do's and do nots. Under do pay attention to the CDC, the Massachusetts Department of Public Health. I put DOH, that actually means that's DPH. The P and the O are awesomely close together on my keyboard. For reliable information. And these presentations right here, I congratulate Dave Mason, J.J. Burke, Fire Chief, Dave Mason, the health agent, for putting all of this together on a regular basis. This is the 19th one, and the local information is always super important. And when I was a member of the select board, I always felt like we were closest to the people, for sure. You know, when somebody's street didn't get plowed to their expectation or when they thought it should be plowed, we got a call for that. And that's really where the rubber meets the road, and I thank you for doing all of this. Take recommendations seriously to protect yourself and others while we're looking for a vaccine and some sort of effective therapeutic. I know that a lot of these are in process, and we tend to be impatient, but you have to realize that it's going to take a while before we find something that's very effective. And a side comment on that is, it's not like the flu. We have flu vaccines. We have therapeutics for the flu, meaning medicines that you can take to move it along quicker without having a severe sickness from it. But we don't have that for SARS-CoV-2. They don't exist yet. And it is more transmissible than your typical flu is. And it's transmissible by people who have no idea that they have it. That's the scariest thing of all. When we look at, well, how are we going to get through this? The answer really is to develop what's called herd immunity. Herd immunity is related to a certain percentage of the population having antibodies, which causes a virus to slow down. And if you're up to 60%, typically, you know, this is like the rule of thumb, you get to 60%, you start slowing everything down. CDC thinks that maybe 70% is more likely for this one because it's so transmissible. But when you get to 70, 80%, essentially, it doesn't have a lot of places to go. There's only two ways to get that immunity. One is to have the disease, although we don't know much about how bad it has to be for you to have how much immunity for how long. None of those questions are answered. But if it operates like other viruses, then we know that that's likelihood. Or to have a vaccine that would produce those antibodies in a way that's synthetic. And if we do that and we get ourselves up to 60, 70%, then I think that we can feel a little better about this. And a therapeutic, not like the one that is out recently that's an intravenous deal that you have to do in the hospital. That's different. I forget the name of that. You remember, Dave? Rev something. When we have something that you could take by pill or a shot or something like that after you catch it, we'd feel a whole lot more comfortable. Until then, you know, pay attention to the do not side of this list. which is don't go searching for the truth on Facebook or other social media sites. It's the stuff that you see out there is unbelievably dangerous. And you shouldn't, just because somebody's put a few words into a meme and makes it look official, I wouldn't take anything from that. Look, we think nationwide, 5 to 10% of the people have been exposed or who have had COVID-19 know it or not. 5 to 10%. You're talking about herd immunity at 70%. We have a long way to go before we can relax. And there was an English study that was done on Massachusetts that said that we think that 13% of the population in Massachusetts has had it, 13%. Well, to get to 65%, you're talking about 5 times more. If you multiply the 6,000 people who died times 5, I hate to be the one who is responsible for the next 24,000 deaths before we get there. So the point is, we need to do those things that everybody's asking us to do. And don't toss common sense to the wind. Think about these things and be responsible. Thank you.
Well, thank you, Randy, for your thoughts and your words and information. That's greatly appreciated. I just want to follow up on one of the things you were talking about as far as whereas the Cape has the 3rd largest population in the state is elderly population, I think you mentioned, and you were looking at as far as funding, how much time, I mean, how far out how far out is the state planning for that? I mean, we talked, you just mentioned the time frame as far as what it would take to get to herd immunity, the amount of time, as far as that type of funding when you look at supporting that populace. How far out are we planning?
Well, the window is not going to be defined by us looking at a calendar today, unfortunately. The amount of time that we're dealing with this is going to be an effect of how long it takes to develop a vaccine to get us to that point. I certainly wouldn't want to use Sweden's approach and just hide the most vulnerable people the best you can and just say, everybody just go out there and do what you want. Unfortunately, they've only gotten to a little shy of 20% relative to people who have been exposed to COVID-19. They thought that they would get to this herd immunity number by the end of May, and that didn't happen.
Right.
And they have deaths that are well beyond every country around them. So it didn't work.
Right.
So the answer to the question is, we'll fund what is necessary for as long as it takes to make this happen. One of the things we're putting a lot of effort and money into right now is tracking and tracing the causes, people that turn up positive, doing more tests, and you do that yourself. I'm sure you've described it in this scenario before. And that type of effort is going to have to go on for quite a while.
Right.
We're also getting a lot of money from the federal help, and more to come, hopefully, if we have next round that Congress is looking at. That would amount to some serious money to be able to put at this. But I can tell you that this governor has done a terrific job of, in very pressuring times, to just say, hey, let's go for it. Look at these other states that are doing that, to be calm, patient, be data-driven, and make sure that we get to where we need to be without tipping the balance towards having more people end up with COVID-19 and dying of it or having serious complications that will be lifelong.
Because you brought up the governor's, the effort by Governor Baker, and we've been working with that as far as if you look at the volume of material that's being pushed out in a very short amount of time. I know people are anxious, to move beyond this. You've brought up reasons why we have to kind of stay in the moment where we are and not move too far out. But as far as have you been involved in that amount of material and communicating with the governor's office on that?
Yeah, absolutely. Of course, we have a Cape Cod group that is working on reopening, and they coordinate. I'm on that, and that group coordinates with the governor's group, which is headed up by the lieutenant governor. I am in pretty much constant contact with. I'm not sure that she loves this fact, but with Karen Polito, who's the lieutenant governor, letting her know what the oddities are that we're dealing with down here that might not be the same as other parts of the state.
Well, that's good to hear, because I think people acknowledge that as far as especially this season, coming into the summer tourist season, and the concerns that residents have, and at the same time, you have your second homeowners that have their right to utilize the property, but at the same time allow businesses continue to operate in some form with recognition of the time.
We want to get there as quickly as we can. Note that the number of cases and the rate of our cases, doing it by population to make it even across the board, puts Barnstable at the fourth lowest rate in the state. And Dukes and Nantucket County end up being the lowest. Somebody's in between us, I forget who. That's good news for us.
Right.
That means it's less likely that we're going to see our numbers head up if we get going a little bit too quickly on reopening. But then there's the wild card. This is one of the oddities that I'm talking about, is we have so many people that come in here. Normally we have 4 million people that show up to Cape Cod over a summertime every year who don't live here. 4 million people. And a lot of them come from places that have been ravaged by this. And we haven't been ravaged by this. Although every death that we have is critical and it's terrible, but statistically we have pretty low exposure, and the testing is telling us that we're doing pretty well as it goes. But I don't know. That's a wild card that I don't know how to predict that kind of thing.
Right. Any thoughts? Because we've been running our own testing program, as far as for, public safety and whatnot. And our numbers, what we're seeing, kind of equate to what you're talking about as far as the low, as far as that percentage that we're seeing.
Right. I think that's awesome.
So,
and I hope we can keep it there.
you had mentioned town meeting. As far as one of the allowances by the state was to allow towns to go to zero quorum. Seem to remember there was something. Did you have foresight on that?
I tell you who had foresight on that, and Bud Dunham knows. Barbara Walling. She was the one who wanted to go to a zero quorum, and the argument at the time seemed counterintuitive that if we had no quorum rather than 200, that we would actually end up having more people show up for fear that 35 people will come and do all the business of the town. And I don't think, since we've had that, and it's probably been a dozen or 14 years, that we have had any problem at all. We've never started town meeting with just a sprinkling of people.
Right.
So God bless her soul. She had a great idea, and I'm glad that we followed through on it.
So everyone involved in that looked brilliant, though, to this time. So
That's true.
So thank you to Barbara for that. So, but is there any other information you want to share with us?
Well, I appreciate being here. I do, in one of those slides, I put my Facebook page up there. If you're any good at all at searching on Facebook, just type in Randy Hunt. The full thing is called Randy Hunt-MA. I think it's up here now. MA State Rep. Every day I post the latest situation report from the state. Every day, just around 4 o'clock or right after that, I post a link that goes straight into the dashboard that the state puts together. So I caution everybody not to go searching for the truth on Facebook, but in this case, it's an exception. You can go here, and it's safe.
Very good. Well, that's good information to know too, because I know there's been a challenge with some people as far as locating. You know, the mass.gov is a massive site as far as to look for the little specifics. So when you're putting out that information, that is an excellent resource for the people to go to. So thank you very much.
Welcome.
So thank you for coming today, Representative Hunt, and as always with Chief Burke. Be safe out there. Please be considerate of each other. Wear your facial covering, and we'll see you soon.